As we defined in our next episode, we talked about diabetes and we define it as a persistently elevated blood sugar in the blood. So we also talked about the signs and symptoms. We talked about the types of diabetes and we talked about the risk factors. So in this episode, we're going to be handling the complications of diabetes and we also talk about the possible management. We are going to talk more about the non-pharmacological management and that's what we conclude with. Okay, so when we talk of the complications of diabetes has a lot of complications. Okay, so we are going to simply categorize them into two. We have long-term complications and we have short-term complications. And this can also be called chronic complications and we have acute complications. So let's talk about the chronic complications first. So when we come to the chronic complications, they are actually long-term problems. Okay, they can develop gradually and can lead to serious damages if they are left unchecked. Okay, one of them, the first one we're going to talk about, is the complications to the eye. So what happens is that some people with diabetes develop an eye disease called diabetic retinopathy, which can affect their eyesight. Okay, so if the retinopathy is picked up, usually from an eye screening test, it can be treated and the sight loss will be prevented. However, if not, it could lead to the loss of sight. Okay, so the next thing we're going to talk about is the foot problems. Okay, so for somebody who is diabetic, the diabetic foot problems are serious and can lead to amputation of the foot if it is untreated. So nerve damage can affect the feeling in your feet, and raised blood sugar can damage the circulation. Okay, so you notice that there is change in sensation in your feet. Okay, and you notice a change in color. Okay, so the damage in circulation makes it slower for wounds to heal. Okay, so when something cuts you, it takes longer time to heal. Okay, and that's why it is important to always consult your doctor when you feel a change in sensation or you think the color of your feet has changed, especially if you are diabetic. Okay, the next serious complication we are going to talk about is heart attacks and stroke. Okay, so when you have diabetes, high blood sugars for a period of time, it can damage your blood vessels. Okay, this can sometimes lead to heart attacks and then strokes. Okay, and the next thing is kidney problems. We call it diabetic nephropathy. Okay, so for the diabetic nephropathy, the high blood sugars can damage your kidneys, making it harder for your kidneys to remove the extra fluid in your blood. Okay, and this is known as diabetic nephropathy or kidney disease. Okay. The next thing we can talk about is the nerve damage. So when there is diabetes, you can get nerve damage as a complication of the high blood sugar levels. It can make it harder for nerves to carry their messages, which we call in medical terms impulses. Okay, so you notice a change in the way you feel, especially in your feet, hands, or any part of your body. The next thing is gum problems. You can easily get problems in your gum when you are diabetic. Okay, for some few number of days, you develop infection in your gum. Okay, this is also one of the complications of diabetes. Okay. The next thing we are going to talk about is sexual dysfunction in both men and women. Some people think this is only peculiar to men, but trust me, it can affect women too. When you have diabetes, it reduces the circulation of blood to your sexual organs. This in turn reduces your sensation. For men, it's pronounced because when there is reduced blood supply to the sexual organs, they are not able to have an erect, or even if they erect, they are not able to have a sustained erection. And this is popularly called impotence in the men. And that's mostly what will even bring a man to the hospital. And you later pick up and notice that the person was diabetic. Okay. So now these are some of the common uh, complications in the long term for diabetes. One other thing I would like to mention is that some studies have shown that diabetes is associated with a certain form of cancers. So when you have elevated blood sugar levels and you leave it untreated or unattended to, you could be predisposing yourself to certain forms of cancers. And treatment of cancer is very complex and it can even interfere with the control of your blood sugar and give you a lot of troubles. Okay, so some of the acute complications we can have include hypoglycemia. That's your blood sugar dropping so low to the extent that you become even unconscious. Okay, you start feeling dizzy and all of a sudden you collapse. The next thing is hyperglycemia, which can also be defined as very high level of sugar in your blood. Okay, the next thing is what we call diabetic ketoacidosis. These are medical terms, and diabetic ketoacidosis in a diabetic is a medical emergency which needs to be attended to. So, enough of the complications. Let's quickly talk about the management of diabetes. I've already explained to you that diabetes management can be put into two categories. We talk of the pharmacological management and the non pharmacological management. For you as a patient, when you are diagnosed with diabetes, the most important part for the doctor is to initiate the pharmacological management. So we will leave that out to the doctor, okay? And then we will focus on the non-pharmacological management, which is very crucial when it comes to the management of diabetes as far as the patient is concerned, because most of the success of the treatment in the non-pharmacological side depends on you, the patient. So we start with the diet and we talk about the alcohol intake, we talk about exercise. So with the diet, you are advised as a diabetic to take a complex carbohydrates such as cane, yam, plantain. They are preferred as a diabetic. And you have to avoid refined sugars and especially those high energy drinks. You have to avoid them. The next thing is you have to see a dietitian to plan your diet. As for a diabetic, for a day's diet, 60% of it should be carbohydrates, 15% of it should be proteins, and about 20% of it should be fat. As a patient, this may not be easy for you to calculate. So I will advise that you see your dietitian to help you plan a diet that will contain these percentages in appropriate proportions. Okay, so you have to, as a diabetic, you have to also reduce your salt intake. That's the next thing I would like to talk about. Okay, the salt intake can also complicate your condition. Okay, so the next thing after the salt intake is fruits and vegetables. And you are advised as a diabetic to take in more fruits and vegetables. Okay, this is very important. It will help to reduce your blood sugar levels and then it will help to increase your body's fighting systems. Okay, your immune system, it helps to make it stronger, and so the infections that would worry you from time to time would easily be taken care of if your body's immune system is strong. The next thing to talk about is to encourage the take of soluble fibers such as oats. Oat contains a lot of fiber which is soluble. Another thing is beans and apples or nuts. Okay. The next thing is to cut off alcohol intake. If you are an alcoholic and you are diagnosed of diabetes, please, you have to take the necessary steps to stop alcohol consumption. Okay, that's the thing. And the last one I'm going to talk about is the exercise. Okay, exercise is very important. It will help to burn down the fat and other things. Okay, so for the exercise, a regular exercise pattern is preferred. Keep it simple though, and then at least 3 times in a day. A simple exercise like brisk walking 30 minutes every 3 days in the week is fine. It's fine. It's good enough exercise for you. Okay. So, but the exercise, you have to also monitor and look out for certain things. For instance, your age. If your age does not favor exercise, please do not try to do it and then end up causing more harm than good. Okay, so this brings us to the end of this episode. We've talked about the diabetes. This is the part two of diabetes. I would like you to share and subscribe. This is very important. Okay, the public needs to know. They need to get educated, and it will help to bring out the general good health that we so much are concerned about. Okay, thank you for watching. See you in the next episode. Bye.